Being categorized as a high-risk pregnancy doesn't really mean that you are completely disabled. Too often, when a woman is categorized as a high-risk pregnancy, she is told to be still, to go to bed, to possibly be on complete bed rest, and that can be rather deteriorating to her health and actually cause more ill effect than if she did some kind of exercise. The category of high-risk pregnancies can be kind of difficult to define. Like I said, it can be anything from just being over the age of 35 to all kinds of various health conditions. The most high-risk conditions that would require immediate delivery or going to the hospital would be your water has broken, you're in labor, you're suffering from preeclampsia or premature labor, and you're having uterine contractions or hemorrhaging deeply, then you must go to the hospital immediately and call your doctor. Other categories that are slightly lighter that will most likely render you on bed rest, but you can still do some of those exercises on your side or seated, is if you have placenta previa, where the placenta has moved away from its original place, placenta abruptia, or you have gone into labor prematurely before in an earlier pregnancy, or you have been diagnosed with a weak or incompetent cervix. There are still exercises that you can do. No, absolutely not. If it's done safely with under the supervision, of course, of an instructor that knows what he or she is doing, and with the recommendations of her medical caregiver, then she can most definitely exercise. Most exercises for a bedridden woman would, of course, be in bed. Her exercises would have to be performed while lying on her side, sometimes lying on her back, and in a seated position. There are certain conditions of high risk that renders a woman recumbent, lying down throughout her entire pregnancy. Then each exercise have to be performed lying down on her side. Any pregnant woman, no matter how high risk, can do some exercises, no matter how little. There's no reason for any pregnant woman not to do Kegels, and most high-risk pregnant women can do all of the side lying and seated position exercises that we're going to show. If there's any risk of premature delivery or any other high risk during pregnancy, a pregnant woman should not, of course, participate in a regular exercise program. It must be severely individualized, and if she's on bed rest, of course, she can't be doing any cardiovascular exercise. She must even cut out such things as walking or swimming or anything like that. But the exercises that she can perform very safely is anything lying down in bed or sitting in a chair or her bed, which are very safe. Now, we only know about 50% of the causes of premature delivery, but they have found in studies that certain risk factors are going to increase your likelihood of premature delivery. And those can be socioeconomic economic status, it can be lifestyle, it can be environmental factors, it can also be nutritional exercise habits, and a single-parent household, all kinds of various issues that can increase your likelihood of going into premature labor. And it makes it even more important that you try and stay as fit as you possibly can and do whatever exercise, however little, that you can to increase your strength and your endurance as much as is possible during pregnancy to have a healthier baby. Stress is a major cause of premature delivery and also a really big cause of preeclampsia. So anything that you can do to reduce your stress levels, whatever they're from, either if it's from work or for a home situation or any other major life-changing situation that might go on, such as a death in the family or a divorce or any such thing, the healthier you are, the more you exercise and the better you eat, the more likely you are to reduce those stress risk factors. So it's very important that even if you are on bed rest and you are suffering from high stress conditions from anything, that you do some kind of exercise, because exercise does increase your endorphin levels, which are the feel-good hormones that make you feel better about yourself and make you feel more relaxed, and also it reduces adrenaline and androgens to help you feel less stressed. If you have been rendered on bed rest by your doctor, you need to go to your doctor and talk to him or her and voice your concerns about the risks of inactivity, such as diabetes, if you have tendencies to high blood pressure, if you have some sort of severe backache or pain or aches anywhere else, if you have a tendency for osteoporosis or in your family, then get the book Expecting Fitness, which is the only book that has a chapter on high-risk pregnancy exercises, and show the exercises to your doctor and go over what you and he or she will think is the most beneficial to you and what would be safe for you. If you're concerned with how much that you can exercise during pregnancy, you need to listen to your body. If you happen to be on bed rest with a severe high-risk category, then you're obviously not going to be able to do any cardiovascular exercise, and you're not going to be able to measure your exercise intensity by any measurement levels. However, you should only do what you feel is comfortable. It should be slightly challenging, but not too much. There's some great exercise tools to use while pregnant, especially on bed rest when you can't really lift any heavy weights, and that doesn't take up any space. You can hide it under a pillow, literally. You have these little rubber bands. These are called Dynabands. You wrap them around your hands, and you can do great exercises to increase and improve your posture for your shoulders and for your back muscles. And also rubber tubing. These are called extra tubing. And you can do the same exercise with that, and there's various other exercises that you can do with these things, lying down or seated. The most important muscle that we have to work during pregnancy is the perineal muscles, the pelvic floor exercises called Kegels. Kegels were invented by a doctor called Dr. Kegel back in the 1950s. And it saddens me to this day, I get clients whose doctors have never even told them about Kegels. And it becomes a very, very important muscle to work during pregnancy because it takes literally a lot of abuse from the added weight during pregnancy. It's a very, very thin muscle that needs to be worked to help prevent incontinence and problems during labor such as tears or episiotomies, and also help the mother get back into shape after her baby is born. So Kegels are done by literally squeezing the pelvic floor muscles just as you would trying to hold yourself going to the bathroom. Although you should never practice this in a bathroom because that can cause infections. But all you really do is squeeze the muscle tight and let it go. And that's it. And it's really important that you perform that exercise at least 50 times a day during pregnancy and then for the rest of your life.
I met Brigida randomly through a woman who just had a baby, and I had said she looked great, and I wanted to know what her secret was, and she said it was her personal trainer, and she was kind enough to give me her name and number, and it was Brigida, and so I went home that day and called Brigida and scheduled an appointment, and we met at my house, and we started working out right away. So I've been working out 26 weeks now, so I've been working out first trimester from the beginning. In the beginning, I had a little bit more strength and endurance, and now that I'm entering my third trimester, I find push-ups a little bit harder because of the extra weight, and just get a little bit more tired, have to, take my time in between exercises, not to push myself, and make sure everything is good. Working with Brigida, she's energetic, she's fun, she's creative, she's punctual, which is great, and we just have a lot of fun together. The most important things that I've learned while working out throughout my pregnancy with Brigida is that I feel like I have more energy, especially the days that I see her. Throughout the day, I'm more energetic, more willing to do errands and things around the house. I just suggest working out just gives you just more willingness to get through the day, and just makes you happier.